Shocking medical mistakes that should have never happened. Alright, picture this. You're lying in a hospital bed waiting for a routine procedure. The doctor walks in, reassuring you everything is going to be just fine. You drift off under anesthesia, confident you're in good hands. Then, suddenly you wake up and realize something is horribly wrong. Maybe they operated on the wrong body part. Maybe they gave you the wrong medication. Or maybe, just maybe, you weren't even supposed to be there in the first place. Sounds crazy, right? But for thousands of people every year, this nightmare is real. Pipe low. Let's dive into some of the worst medical mistakes in history. Real cases of human error that cost lives, shattered families, and changed medical procedures forever. Let's get into it. Think about this. Have you ever woken up from a nap and feel completely disoriented? Now imagine waking up in a morgue. That's exactly what happened to 91-year-old Janina Kolkiewicz. She was pronounced dead. The paperwork was done. Her body was taken to the morgue. Everything was normal until a few hours later when a worker saw something that made his blood run cold. The body bag. It was moving. Now, if that were me, I'd be out of there before you could say zombie apocalypse. But this guy? He did the right thing. He unzipped the bag, and there she was, breathing, alive. Turns out she had never been dead. The hospital had made a mistake, which begs the question, how many people have been buried alive because of errors like this? Because believe it or not, over 30 people a year are mistakenly declared dead. That's a terrifying thought. Also is the man who had surgery on the wrong side of his brain. Yay, I know your guess, it's brain surgery. Not exactly the kind of thing you want your doctors guessing on, but in 1995, a Florida man named Willie went in for a routine brain procedure, and somehow the surgeons operated on the wrong side of his brain. Let that sink in. They marked the wrong area, made the wrong incision, and by the time they realized what was happening, the damage was done. Willie was left permanently disabled. And if you think this was just a fluke, think again. Surgical mix-ups happen more than 4,000 times a year in the US. That's why hospitals now have a mandatory timeout before every procedure, where the entire surgical team confirms the patient, procedure, and exact location before a single cut is made. Good system, right? Except that mistakes still happen. Another are the babies who got the wrong medication, and trust me, this is absolutely terrifying. In 2006, actor Dennis Quaid's newborn twins were in the hospital. They needed a tiny dose of heparin, a blood thinner, to prevent clotting. But instead of the baby-safe version, a nurse accidentally grabbed the full-strength adult dose, 1,000 times stronger. And just like that, these fragile newborns were injected with a dose meant for fully grown adults with serious blood clotting conditions. Their tiny bodies couldn't handle it. They started bleeding internally. It was a race against time to save them. Luckily, doctors caught the mistake in time, and the twins survived. But many others aren't so lucky. Medication errors like this kill over 7,000 patients every year. Let that sink in. 7,000 lives lost because of simple mistakes like grabbing the wrong bottle. And there's a man who had the wrong organ removed. Damn, this is scary. Let's talk about Reeves. He needed kidney surgery. One of his kidneys was diseased, and doctors were supposed to remove it. Simple enough, right? Except they removed the wrong one, which meant he was now left with 0 functioning kidneys. By the time doctors realized their mistake, it was too late. Graham didn't make it. This case forced hospitals to introduce stricter surgical checklists, multiple verification steps, and stricter accountability measures. And yet, this kind of mistake still happens today. So what does all of this tell us? It tells us that medicine isn't perfect, that doctors, nurses, and surgeons, no matter how skilled, are still human. And when humans make mistakes in medicine, those mistakes can cost lives. It also tells us that we can't afford to be passive. We have to demand better training, better safety measures, and full transparency from hospitals and medical professionals. Because here's the truth. If you don't double-check, question, and advocate for yourself in a hospital, no one else will. So next time you're in a medical setting, ask questions, confirm your procedure, make sure your name is on that chart. Because as we've just seen, even the professionals get it wrong sometimes. And when they do, it could be the difference between life and death. What do you think was the most shocking mistake on this list? And do you think errors like this still happen today?